I think I'll start with Tom, and it is a question about access to toilets. You'll be well aware, I hope, that I and many others think that the lack of toilet provision in London is not just a matter of public health, but of health inequalities. And there are people who are especially disadvantaged by the lack of provision of toilets, and this includes people protected under the public sector equality duty, disabled Londoners, people with health conditions like Crohn's, bladder, bowel or prostate cancer, diabetes, multiple sclerosis and Parkinson's, and other groups, including anyone older, pregnant or accompanied by young children. And that's not an exhaustive list. So, Tom, briefly, my question is, do you agree with the principle that access to public toilets is a public health issue?
The short answer is yes. The short answer is yes.
Excellent.
Because I recognise all those clinical conditions which will require often an urgent access to the toilet, and also my day-to-day work with patients, especially elderly patients with incontinence. They will often stay indoors purely because they haven't got confidence to go outside to go to a toilet. So I do recognise that, yes.
Excellent, that's fantastic, thank you. And related to that, access to toilets in London is geographically uneven. Age UK London, who are in the audience, recently found that 3 of our councils have more than 50 public loos, but 7 of them have less than 10. Havering just has 2, and Redbridge just has 1. Now, I'm not here to have a go at councils. This sits with years of very, very tight budgets, so it's not their fault. But the Assembly Health Committee has agreed in the past, cross-party, that it would be helpful for there to be a statutory duty to provide public toilets as a public health measure. Now, I'm not saying which body should be responsible for them. It could be councils, it could be national government, or in London it could be the GLA. But do you agree that the responsibility for providing public toilets should lie in the public sector so we can end these loo deserts and reduce this inequality in our city?
So I recognise that the disparity of provision seems to be very unequal, and also you're talking in the areas which are the poorest parts of London seem to have the poorest provision, and that seems desperately unfair. And recognising everyone's budget is financially stretched, that a coordinated plan to make sure accessible toilets are available would be a very sensible thing to do. I am aware that the London plan for the next iteration is going through a consultation at the moment, I think ending on the 22nd of June, and I would imagine that that would be a great opportunity to feed that information into. What I'm very much aware of is that when I had, in fact, a session with public health leaders and Jules Pipe, Deputy Mayor, on yesterday, and in fact that came up again.
Excellent. Very glad to hear that, and I'll make sure everyone feeds in.
So I would say that is the way I would perceive as the probably most effective way to try and get addressed on a London basis.
Great, that's really helpful. Vicky, to you, Age UK London's recent report about toilet provision called Lifting the Lid, I know it's been sent to you. Have you had a chance to have a look at it?
I have skimmed it.
You've skimmed it.
It's been
Excellent.
a busy week. I can't pretend.
No, don't worry. There's some fantastic recommendations in there, and some are specifically for the GLA, like making a GLA public toilet action plan. So would you agree to meet with me and Age UK London and the London Loo Alliance, who are a group of campaigners, charities, unions and activists looking to improve toilet provision, to discuss their findings?
So I am more than happy to potentially meet. I'm in touch with the Communities and Social Policy team, the planning team. I guess our unit's role is working with the levers of the GLA group. So let me just touch base with policy colleagues who may already be in touch, and then we can pick it up from there.
Perfect. Thank you. Thank you very much. And then, Vicky, again to you, and moving on to a slightly different matter. I've had some very worrying correspondence from a trans constituent who can no longer safely access changing rooms and toilets at their local Better Gym leisure centre because of new rules brought in by GLL, the company behind Better, after the Supreme Court ruling. Now, I was told that GLL has taken a company-wide operational position to broadly implement the Equalities and Human Rights Commission interim guidance that was published in April. Now, these new rules from GLL have been brought in across all their facilities, including, and this is why I'm bringing it up with you, Crystal Palace National Sports Centre, which they run on behalf of the GLA. So, were you aware of these changes before they were brought in? Was there any consultation about this change in policy at a GLA-owned facility? And are you concerned about this in terms of accessibility and equality? I don't expect a full answer right now, but if you could look into what has happened and write to me, I'd be very grateful.
Happy to pick that up.
Thank you very much. And then picking this up with Tom, it is worrying that bodies delivering public services seem to be bringing in rules before any guidance has been finalised and while the EHRC consultation has only recently opened. Now, as Senior Health Advisor to the Mayor, are you and is the GLA working on a response to the EHRC consultation to ensure that the rights of trans and gender diverse Londoners are fully protected?
I am unaware of the process that you've requested information on, but I will find out for you and pass it back to you. I don't want to give an answer here which isn't fully informed, so may I get back to you on that, please?
That would be very helpful. I think that the Mayor has told me that his position is clear. The result of the ruling mustn't mean more stigma and discrimination against trans people in London. And so he's been very clear about the need to keep an eye on this. And I think it's also critical that trans and gender diverse Londoners know that we have their backs and that they can get on and live their lives using facilities that they've accessed safely, in many cases for decades, without hindrance.
And I would share that perspective as well.
Thank you. Thank you, Chair.